This is episode 4 of Muscle Fix Mobile Podcast featuring Dr. Nicholas Kuzmanovsky and Dr. Vincent Tufuri. Today we are featuring IFBB Pro Christopher Tuttle, who is also the owner and founder of TuttleNutrition.com. Chris, can you please tell us how you got started on this path to being both a business owner and a professional bodybuilder?
12. I raced motocross my whole life, and then when I started racing, I wasn't very good. I was obviously great with your friends in the neighborhood, but that's not really, the sample size of what really goes on in competitive racing. So I got a trainer, and the trainer kind of went into my parents' house and threw all the junk food and gave us more of a, would you say, a general balanced diet, protein, carbs, and fats with every meal, eating 3 to 4 feeds per day, healthy snacks, just to get better food. It wasn't anything groundbreaking or specific. It was just more, nothing measured either. But I noticed that I had a very fast response visually to my body and performance while racing. So I became more interested in nutrition at a very, very young age. So like when we would go to, say, brunch and they had an omelet station, I'd see the guy make egg white omelets. I'd ask egg white omelets. And way back in the day of 93, 94, egg whites weren't really a thing at buffets. But that's how it first started. And then he also put me on a weight training program, which was more kind of a CrossFit style, but my body became leaner and more muscular looking. And I was like, wow, this exercise and this nutrition for motocross is making me appear much differently. And that's when I started to become more interested in bodybuilding. I'm like, wow, I could train even differently to get even more muscles. I didn't know, when you're young, I didn't really associate that effort put forth with a visual return. So that was, and of course you're stronger than your friends wrestling. So like, that was a plus. So that was like the kind of the kickoff of being more into it and learning more about it all through high school.
Oh, okay. Interesting. So kind of happened simultaneously, basically. You have.
Yes, correct.
Hey, Chris, I read something in something you had put out. I guess it was on your website. You were also hypoglycemic when you were 10 years of age.
Yes.
So that kind of led you down a better road to some nutrition, or you kind of weren't quite sure what to do at that point because traditional care, medicine didn't typically address it until it was a bigger problem.
Well, I'm lucky. Like my father's a physician, so my dad did the glucose tolerance test at home. And some things, and he goes, your blood sugars are like 110 after consuming 120 grams of sugar. Wow. And then after like an hour, they dip down. So I know at a young age, I kind of like real young, 5 or 6, 7 years old, I noticed that, say if we go to a kid's party and they had snacks and sugary foods and I'd eat them, I wouldn't feel right, And every kid's running around. I didn't feel good. But if mom brought me to like Subway or Blimpie and I had a sandwich, I noticed that I felt better. So even before I got into nutrition through my trainer for motocross, I associated certain foods with making me feel a certain way. So I would automatically gravitate towards like a ham and cheese sandwich versus chips or just fruit, when I was young. So that's how that started. And then I kind of ate more frequently, but more solid meals. I didn't really understand it and really control it until I, got into bodybuilding but it was a pain in the butt. And especially it kind of led to, and I know hypoglycemia is not linked to migraines, but I went through a whole spell of a few years of really severe migraines. And then when I corrected the diet, it never really happened ever again.
Yeah. It was kind of an innate thing that led you down the path possibly of what you're doing now.
Yeah, it was 100%. It was motocross training. It was motocross training that changed my body. I saw the nutrition made me feel better. And I initially just wanted to learn more about training because I thought training was the answer. And then right after high school, I didn't want to go to college. I just wanted to race. That's all I wanted to do. And then I became a personal trainer. And there was a registered dietitian at this gym that I worked at who was a dietitian, and he put us through a program as a part of, a marketing, right? So he put together this program for me and for my, for riding, very specific to me. And I got shredded and I felt great, and he opened me to the idea of like Ezekiel bread and all these different types of different foods I wasn't aware of and a style of eating. And then I'm like, well, maybe I actually want to go to school for nutrition because I think actually nutrition is a little more important than just training, considering how much I changed my body within 3 months versus, at that point, about 8 years of training, So that started, and then I became a dietitian. And then I always wanted to bodybuild because I thought it was cool, also looking bigger. And my trainer would freak out. He's like, you can't bodybuild and race motocross. You have to be like a jockey, So
Right.
a lot of run, biking, swimming, CrossFit style training to be efficient. So when he caught me weightlifting heavy, he'd be mad. So when I finished racing motocross, like legitimately a week later, I sold all my bikes and went right into bodybuilding 100% to give it a shot. And then once I did one show, I was addicted. And one thing about bodybuilding is you can't come back the next week and correct a bunch of things and look totally different, right?
Right.
It's another year. Or motocross, you can work on your corners, you can work on your rutted corners, you can work on kickers and change things within a week. But so it was a longer, process of change. And that's what kind of ultimately led to everything now. And everything wasn't planned. I never actually wanted to start a business. I never intended to. It was just something that unfolded along the way of years of me bodybuilding, me hiring somebody to do my first show. It didn't do so well. I picked up a bunch of books about bodybuilding, diets, and concepts, and applied those to myself with my knowledge of nutrition at the time I was in school. Did my own show. I did really well. I won. My second show I did myself. And then a guy at my gym goes, hey, you look really good this year compared to last year. What'd you do? And I go, well, I did some research and did this and I applied it and it worked. And he goes, well, can you help me with my diet? And I said, I'll be honest with you, I don't know what I'm doing. He goes, but $50, I'll give it a shot. And then I helped him and he won. And then his friend said the same thing. And then here we are about, 17 years later, and it's just word of mouth, word of mouth, word of mouth, word of mouth. And it eventually got to the point where I quit my job as a dietitian at the hospital and then do this full time at home.
Interesting. So at what point did you actually get your pro card, by the way?
2013.
Okay, so it's been a while. Gotcha.
Yeah.
Let me ask you this too. So when that massive change in your friend that he found so impressive, like what did you do differently for him that made that kind of result and so far as alter his diet?
Well, just like weight loss, just like elimination diets, just like most nutrition or progressive-based nutrition programs, it's about following something consistently. You have your hypothesis in your head, like, oh, we're going to try to shoot for 1.5 pounds of body fat loss, and we're going to make these variable changes. You're going to follow this exactly. The client, the competitor is the subject, and then you have 5 days, and then you assess your look, and then you make a change. Or I think a lot of people forget that the process is you have your variables, you change and you control them, you stay consistent, you make another change. And that's what I learned going through the prep of my own, is like things are systematic and progressive based on your body's response. Where a lot of people make changes based on emotion, or I just feel off today, I'm going to cut more carbs, or I'm feeling really hungry today, I've got to justify eating more food. And they kind of pay attention to the wrong biofeedback markers. And that's really kind of what I grasped in the start. And obviously years and years go by, I've learned more and more. But basically his diet was kind of all over the place, and he was kind of almost starving himself to low calories. Mm-hmm. You get that metabolic shift too early, and leptin drops and ghrelin goes up, and then it becomes much harder to lose that last bit of body fat for a show. But I just applied the same things that I learned from the books I read, and obviously things are a little different now, but and obviously condition and what is asked of a competitor these days, condition-wise, is much greater than it was 17 years ago,
It's interesting you say that because, again, these other interests kind of diverged into, I guess, us figuring out that those in the bodybuilder community really could use the services we're providing in general for two reasons: aesthetics, and also because of the injuries sustained while very heavily training. And also, too, as I said, Dr. T handles nutrition. And we found that a very systematic approach, a body compositional analysis, that is to say, to figure out your body chemistry, your ratio of fat to muscle and whatnot, as well as your hormone levels, would actually be the best way to, as you said, dictate a consistent diet to get that type of result. So that being said, have you ever had any nagging pains or catastrophic injuries over the years?
Oh yeah. And that's the thing, in bodybuilding, especially bodybuilders, not knocking bodybuilders, but bodybuilders are pretty stubborn and kind of one kind of closed-minded to a lot of things until they run into a problem. So I always call it the school of hard knocks,
Mhm.
certain things, and you're like, hey, you better cut that out. I'm like, oh, whatever, I got it. A month later, they can't feel their leg. They got sciatic pain or something. So I've sustained a lot of injuries over the years. And actually, I was pretty much injury-free up until I was 28. And then tore a hamstring. Then I tore a tricep, tore a pec. Then I got really bad chondromalacia in my left knee, which still exists, and the knee's pretty much toast. I mean, I can function, I can lunge, I can squat 275 without pain. But I mean, there's no going back to squatting 5 plates,
Right. Yeah.
Not going to happen. I can run, I can sprint, but loading the knee under severe load, dipping that far is not going to happen. But I've learned a lot through, a lot of those injuries occurred because, of the muscle balances being exacerbated, my own genetic, everybody has their own, as you guys know, everybody's genetically prone to a specific muscle imbalance, or, if they're kyphotic neck or lordosis or anterior tilt of the pelvis. And a lot of times we'll adjust our training technique to suit our physique so we can lift more, but we don't realize that we're making that worse. And then all of a sudden one day you're in a fatigue state and you compensate a little too much to one side to the other, and then boom, you tear a muscle, or, in my case, my knee. And that's kind of how the cookie crumbles. I tell a lot of my clients now, I'm like, you got to find somebody who's really knowledgeable, chiropractic or a PT, and who can help with the injuries. A lot of them just say, I'm just going to rest it. I'm like, resting is not going to do anything. You're going to feel better for like a week. You're going to go back and do heavy presses, and it's going to come right back again. You got to figure out what the problem is and address it. So I've had tons of that. But it's, it's same to you guys, Token. It's very hard to find people who really know what they're doing in that field, because every physical therapist obviously doesn't know severe athletic injuries or powerlifting injuries, and I'm lucky there's a nationally ranked powerlifter PT guy that helped me, so he understands what I'm doing, but that's the hard part. That's the hard part.
It's unfortunate, believe it or not, most people don't, and I'm sure you're aware of it, they don't realize the grueling effects associated with motocross and the sustainable injuries that happen too.
Oh, yeah.
Realize how, people think, you buzz it around on a motorcycle. The level of athleticism to become proficient in that sport is significant. You're basically attached to a motor and you're flying in different positions, up, down, over humps and things. And so just think about some of those traumas that you might have sustained even starting then at an early time, developing adhesions and scar tissue, which altered your biomechanics. And as time went on, as you started to load with heavy weights, even though you've developed muscle mass, the joints can only sustain so much traumatic injury. I'm going to endorse a little bit about what Nick does. Nick is he's not the average PT, nor am I the average chiropractor. And that's what kind of drew us together. And we integrate basically that comprehensive approach. When we treat a patient, basically I look at everybody as an equilateral triangle, whether an athlete or, mom, grandma, whoever it might be. And we adjust their protocol based upon three things: structure and function, biochemistry and toxicity, and emotional well-being. And basically it's an equilateral triangle. One goes out of a balance, of course it affects the other. So just like you said, sometimes a person will train so aggressively that they're not even listening to the body signals that their body's trying to tell them that they need to vary things. But, it's sometimes people just learn the hard way. So having that comprehensive approach with people who know what they're doing really makes a difference. And that's what we're trying to get out, doing things like this in the podcast to try and, engage people to make them have a better understanding that there are other things than the traditional things that are typically being taught. Most of us who are doctors, including Nick and myself, you learn a core curriculum, but you really learn not only from all the postgraduate work that you do, but the interaction with your patients. And no one fits into the exact same, hole. You have to adjust and do everything. So everything that we do is a customized protocol based upon the individual's needs. We start with some basic neuromusculoskeletal assessment, the SFMA, we're looking for restrictions. A simple thing that can be done pre and post treatment is progressive, and something simple that could be done aside from the more aggressive types of things. And when we find a pathological issue in a joint or something, x-ray, blah, 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 MRI, and if necessary, more progressive things. So we're kind of working very comprehensively, and we've now adapted. I have a holistic neurologist I work with. We have an orthopedist on board. So we're trying to round out that whole approach to trying to get out to the groups that can need the help. And this particular industry, I think, once again, is something that's underserved to the level of what needs to be done. And what do I mean by that? you could put regular gas into a regular car and have an expectation. You put regular gas into a high performance vehicle, it doesn't work as well. So you really have to step up your game. And as you said, there are probably a lot of people who just don't have that knowledge, or sell something and it's not quite the same thing.
You know, listen, for the listeners out there, like, I don't know you guys personally, so like I have nothing financially attached, but I will tell you what you're saying is 100% dead on with my experience, even with coaching people. Like emotional, functionality, nutrition, individualism, of those three are paramount. And a lot of times in the younger population, I always try to tell them, just because you don't feel the pain doesn't mean that's not coming. One. Two, because you don't feel the pain doesn't mean you're operating in proper function either to maximize your lifts.
Yep.
Because I think that's a huge missing component, because people always go by how they feel. I feel fine doing it, and you understand, but it doesn't look fine. It's going to break down. You take that Honda Civic and you ride a hard 100,000 miles, it's probably not going to go much further. Okay. If you do it correctly and you take care of it, you might get a lot more out of that vehicle, just like you might get a lot more out of your body. You have an expiration date on that body, and you can determine when the expiration date's going to be. I destroyed my body, and I wish I had resources available and the knowledge that I needed then, because I was almost in the point of repair versus prepare. I was trying to fix everything after it was all falling apart. But emotional is huge, because I get this question all the time, guys, where, hey, do you think I can be a professional bodybuilder? Well, based on your genetics, I would say possibly, but mentally, I don't know. Well, I really want it. I'm like, well, that's what everybody says.
Right.
Understand, everybody on a good day can be positive, but when everything's going to shit and everything's horrible, can you still keep going? Can you have a catastrophic injury and emotionally still come back and perform? Not many people can do that. I mean, how many people we know who are on the top of their game at a sports, they had a catastrophic injury and they came back and they still won? Not very many, because it usually destroys their morale, you know?
That's a great point. One of the things that we're seeing in our practice right now, especially, is that we deal with a lot of young athletes. And that's one of the things I train. I started working out at 15. I'm going to be 65. I've been training for 50 years. In the last 6 years, I went from some powerlifting to reining it down, dropped 35 pounds, just because as I got older, I just found doing it and being leaner. In actuality, recently, what you engaged in before, the aspect of CrossFit. Now, here's the interesting thing. I just started a CrossFit gym about 2.5 months ago. One of the reasons why is because my gym was shut down. And the reason why this place was open is because they were well connected in the community with the police department and everything else. So they were able to stay open. With that being said, I will tell you, it's probably one of the best training protocols I found for me, especially at this age, with a multitude of different things. I've had 8 herniated discs, torn rotator, elbow tear, hand tear, things of that nature. Most of it came from training. Some of it came from even some of the work that I did, because I'm basically working biomechanic and I take care of myself. So one of the things that I learned a long time ago, I started seeing these young kids coming in, and I used to train one of the top cheerleading athletes in the country. And I could not believe the number of injuries that she had at 16 years of age: neck herniation, lumbar disc herniation, falling from the top, being thrown in the air. And it led me down a path where I started studying this more and more. And one of the things I realized right away was that if you're a professional athlete, you don't get to go into that gym till you're screened appropriately. I don't know about you, but when I was a kid, you hang out with your friends, you start training, you're beating the hell out of your body, everybody's trying, it's a pissing contest, and everybody's trying to lift the heaviest weight. And here's a guy trying to deadlift 250 pounds, where they're basically 110, 130 pounds, in extreme kyphosis, no pressure, no alignment of the knees and lower extremity. They're blowing out their back, they're blowing out their knees, but because they're young, a lot of the times the symptomatology is not as great. You heal faster, your HGH levels are in, all the different things we're talking about.
Yeah, you feel great.
They don't realize what they're doing to their body. So it was one of the things that we started looking at and saying that these kids are athletic athletes at a very young age, and they have to start being looked at. And we see that now in whether they call it for lack of a better term, the midget football league. These kids are getting involved in major contact sports and getting banged up. And, the parents are cheering him on. The dad, who's the old jock, say, go out there. And he starts crying, Daddy, I'm hurt. Says, get back out there again. And then they bring the kid in. They said, I don't know what happened. Well, you don't know what happened. Then we go through the history and said, this child was injured. And even the coach didn't pull him off when he should have been pulled off on that day. And I'm sure you probably experienced some of those things too. So a lot of these things, what I'm getting about is it starts early on. And it's great that you have the knowledge, the wisdom, and the mentality now working with the people that you're dealing with, because as you know, the standard American diet is bad. And some people think that, well, they're going to go from a high glycemic diet to a low glycemic diet, and that's the full change right there. They don't realize the appropriate balance of protein, the essential fatty acids, the proper mineral intake, rebalancing their body chemistry, even at an early age, giving them the right thing, and doing it all through a more holistic, natural approach, nutraceuticals, things of that nature. So it's great that you're working with this industry. It's great that you're doing the kind of stuff that you do. I saw some pictures of you and your wife. You're obviously hitting it hard. You're doing a great job. So, kudos. It's great. Keep going, man.
Thank you.
So, Nick, let me ask you this. Given what Chris said, his injury is, his issue with his knee, what would you do for him?
Yeah, great question. First and foremost, I want to thank Chris for taking the time to come out and do this with us. Because again, we're quite passionate about the stuff we do and that we can help our clients, our members, and the community in our country to do this. And one thing I mentioned the other day too, Greg, is the traditional MD. No disrespect to your father being an MD, but the amount that they know about nutrition is poor, to say the least. And including myself, physical therapist, we legally can't so much as advise protein, let alone water intake. So the restrictions, and unfortunately, despite our high levels of education and continued daily research and jamming and talking shop with, people of your caliber, it's just really interesting that we learn about daily. So just when you think you know something, you really don't know anything. So that was just kind of quite fascinating how your brain from like dad's MD perspective, traditional medicine, and the power of the medicine that you're really bringing up in the nutrition. And Dr. T always says, basically what Mother Earth gives us and from the ground versus the poison and the plastic that we're, I guess, eating in the supermarket, let's say the traditional American diet. And even just recently, literally like since I got married 5 years ago, did I start really, I guess, studying this stuff and taking it in 10% as serious as it should be. I'm not nowhere near the caliber of what you, Dr. T, has done for over 40 years. So it's just mind-blowing to me through the traditional pyramid that Greg and I went to school and learned about nutrition and Penn State kinesiology and the DPT at Rutgers, and the nutrition of this practicality of nutrition was non-existent, including in DPT school. So just freaking mind-boggling. Why? I could tell you why, because it's all about the bottom dollar, unfortunately. But the truth of the matter is when we talk amongst friends and family and the power of this stuff, it's just mind-blowing. So to wrap around for what I would do for Chris with chondromalacia, because it's so common, because it all comes down to pressure of these injuries, right? Something's got to burst one day. It's going to go to his knee. It's going to go to his back. So one unique thing, which Chris, you should look up, is a factor certified provider, which it means function and kinetic treatment while rehabbing. Got to write that down. It basically was a technique with surgical grade Graston tools designed to treat you while you train or while you provoke the pain or the symptoms. It's so simple, yet so mind-boggling. When I learned it and I saw it, I'm like, why the hell was I not taught this about 20 years ago? And why doesn't the whole world know about this? And Dr. T can attest to it too, because it's actually a chiropractic modality which was designed by a retired U.S. Olympic powerlifter. So someone that knows his, has been there, done that, and has had many injuries and treats many high caliber athletes and the average Joe and grandma's knee replacement. So it's basically, again, a surgical grade steel tool. I call it more or less superficial surgery. So doctors always say you can't break scar tissue, or surgeons say you can't break scar tissue. BS. Dr. T sees it every day. I see it every day. Those adhesions and restrictions, which 9 out of 10 nagging pains or injuries is soft tissue in nature. The joint, despite positive x-rays and MRI findings, it's not necessarily the source or generator of pain. So that tight low back, that tight neck, or that tight kneecap that you're dealing with, there's no reason you shouldn't be squatting like you're doing anyway in the lunges, even with at full capacity. That's holding you back from the next level. So again, you shouldn't. And unfortunately, a lot of people settle with like, man, that's just whatever I got from 20 years of powerlifting, weight training, motocross. You shouldn't have to live with that. Now, unfortunately, through the traditional paradigm and insurance and in the clinic, will you be covered through that for insurance? Probably not.
Now.
This guy's a bodybuilder. They're going to look at you and say, basically, with our notes and whatever, how we have to doctor it up and we have to beg and plead for the insurance to cover for you. So with that being said, where Dr. T and I are shifting is basically a fee for service like you're doing, because the real medicine and nutrition and education and mindset of all this stuff is priceless, period. You can't put a value and a number on this stuff. I believe that. I know you guys all believe that. But unfortunately, we have a responsibility to, again, get out there and educate and what we can do. So the modalities, again, like Greg mentioned and kind of hinted at, hence Muscle Fix Mobile. So we're a mobile unit that travels to gyms around the country, literally from the Hamptons to Connecticut. We might be doing a national bodybuilding show, hopefully the team and I, soon, to do the factor technique, which is the deep scraping. Number 2, cupping. I don't know how much you have or haven't done. I was brought to it as a gag gift from my wife. Literally, I tell this story every day. And I'm like, who the hell's going to do cupping? What's the point of this? This is ridiculous. This woo-woo Chinese medicine, get it out of here. So I started experimenting on myself and clients and family. And they're like, I don't know what the hell you did, but please do it again. And I started building this following. So I was like, wow. So I combined the deep scraping or my factor certificate with the cupping. And another thing, which I'm sure you're doing daily, hopefully, is the percussion vibration massage guns. Right?
Yeah, I don't have any massage guns. I have a mobility program that I go through, but that's about it because I'm at my computer all day long. I have a standing desk, of course, but you don't move, you get stiff. So,
right.
I change positions and I have like a mobility thing that I do. I do not use any of the guns. I have one, but I used it for a while and just didn't keep up with it. Didn't see the difference that I expected to see. But then again, I'm not qualified to know how to use it properly either.
Yeah. Again, it's really marketed as a professional recovery gun. So big word, recovery. What do we do when you're not training? What do we do when we're not working? How are we recovering? And again, the who's, heck, since 2013, you've been a professional bodybuilder, so I don't know how you still continue doing it for almost now 10 years. But the name of the game is recovery to train for doubles, triples in the next show, basically. And that's something, again, unfortunately is undervalued and underpaid for because, again, insurance, if insurance doesn't pay for it, then why should I pay for it, basically? So That was the problem kind of I hit at 10 years out in the PT world where I'm like, insurance, those days are long gone. So we're more or less strictly self-pay, fee for service, and we do this type of body work or muscle fixing from treating that chronic chondromalacia to, again, that stiffness and tightness. So if you're sitting here on a podcast, which I've done this with clients, I literally do treatment with the massage gun, with the scraping, and I'm doing body work, and we literally offer and do treatment 24/7. I go out sometimes 3:30 in the morning, believe it or not, for people that are high-profile people. And as early as 5:30 a.m. this morning, I told Greg I had a client. I get it. You're busy. Dr. T's busy. So the 24/7 principle was born and it needs to be done. And that's kind of what we're doing to kind of sum it up. So again, Greg, with Chris's case, or like a lot of these cases we see, I don't care if it's chondromalacia, if it's knee arthritis. To me, it's just a very fancy medical diagnosis. Excuse my French, but I really don't give a shit what the diagnosis is. The treatment is the same protocol. We need to improve mobility, range of motion, and treat the soft tissue component. And the way we do that, and what's unique about the Muscle Fix method, and including chiropractic, and some other unique modalities that nutrition does, is the key word here is blood flow, period. It's just why our body heals, how our body heals, And even in terms of bodybuilding, the aesthetics and the leanness, it's interesting with the cupping I've done where you can make it more vascular, you can make it pop more. And it's literally the difference between being an amateur and maybe first place. It's almost, I say this, it's almost borderline cheating, actually.
Real quick, so again, your method is that you actually treat the person as they're doing the motion that gives them pain. So how does that work in Chris's case?
So in Chris's case, he mentioned before, he said, oh, I can't squat 500 pounds, I can squat X. We would squat him with just body weight first. So we treat the knee, meaning scrape it, cup it, percuss it. So we basically scrape it, suction it, and vibrate it to break up the scar tissue. And problems happen under duress and under function, under load. Remember, this technique was designed for Olympic athletes. They don't say, Chris, go home and take it easy, honey. They say, Chris, get on the field and start training and suck it up with the pain. So again, actually doing the treatment and not just neglecting and ignoring our pain levels. Again, like you guys mentioned and Dr. T said, listen to pain. And to me, tightness counts as pain. I'm trained that way. So living with tightness is not normal. Like when you were 12 years old before motocross, did you have tightness? No, you were 12, but I don't care if you're 30, 80, or 90. These signals to our body are signals. It's the check engine light that we're ignoring. Like Dr. T's analogy is like check engine before catastrophe occurs. And most people will suck it up and then we'll just hear another war story of how I blew out my back and how I blew out my knee and I ended my career. So somehow you've been blessed, probably through your dad's medical background and having the resources from starting at an early age. And again, thanks for what you're doing with your company and sharing the knowledge and helping people that way, because we need more of that, period.
I agree. Thank you.
Chris, where are you located?
Berlin, Connecticut.
Oh, okay.
So central Connecticut, and that's basically.
All right.
Okay.
Excellent. That's good. Another modality I would recommend also, especially with a high-end athlete, actually for everybody. Did you ever hear of PEMF, pulse electromagnetic field therapy?
I have heard of that, yes.
It's a pretty amazing thing. It really deals with the electron potential of the body and how that cellular energy allows the body to heal appropriately. And one of the things that we talk about always is getting the body to a better state of physiology and function. So what this basically does is an atom is made up of a neutron, a proton, and an electron. Right now we're sitting in front of a computer like you do all day. That electromagnetic field that you're surrounded by robs your body of energy. We're an electrical thing. You don't think so? If you stopped your heart, what do you think is going to start again? They're going to zap you with paddles and they're going to bring you back to life. So the whole component will be of this thing is that the cells of the body basically are supposed to be at a level of negative 70 millivolt amperage. And most people are between negative 50 and negative 20. If you have any adhesion or scar tissue, you're at negative 40. So you already fall into that realm of an issue. First time I started getting involved with this was by happenstance. I had been at a conference and I was out, talking to some of the people who sell their different products. And I saw this kind of unique machine. I didn't know what the heck it was all about. So I engaged the gentleman who was talking about it. And if you get the opportunity, go on a website called pulsecenters.com, or you can just go to my website, tefurywellness.com. And they'll tell you, we'll spell that last name for you. And there's a whole series of videos and information about what this thing can do for you. Basically, it's just healing your body from the inside out and raising up the electrical potential of your body so your body can function properly, simulating the mitochondrial function, getting the ATP production done, getting the body to heal appropriately. So especially, once again, at a high performance level with high athletic stress, this is a great thing to be done. And basically, you're just sitting in a relaxing mode. You just basically have anywhere from a 20-minute to an hour session. And you'll find that within a short period of time, your body starts to feel dramatically changed. So you combine that with the appropriate training, the nutraceuticals, the proper diet, getting appropriate physical therapy, getting appropriate chiropractic care, and working within that paradigm, including the PEMF, and you're going to bring your level to the next level up. And this is some of the things, once again, that as most practitioners are not utilizing. This is what we do within the context of our company too. So, you want to come down and visit us, you're not that far away. We're in Fair Lawn, New Jersey, but you probably can find a practitioner. Just Google PEMF And you could just actually go to thepulsecenters.com, put your zip code in, and find somebody who has a machine. They're not inexpensive. The machine costs about $40,000. But, I use it as part of the holistic paradigm that I do, and I've had incredible results, and I've had the machine for about a year and a half. So once again, it's another tool in the bag of things that can be utilized to bring the person up. And it's not invasive. There's no real negative side effects. There are very few contraindications. The major contraindication is if you have some sort of battery-powered device in your body, whether it be a defibrillator or an insulin pump or something of that nature, you can't go on it. Same thing, pregnant or nursing. We always say don't do that because you're liability issues, but there are people that have been pregnant on this machine. They love it as well. So it's a great, great thing, once again, to help you to look at as an added thing right now to help yourself heal rapidly and develop better functionality in your body. So
Chris, let me ask you this. Do you have any shows coming up, and where can people find you, your business, that is?
No shows coming up. I just been focusing on the business, working crazy hours. I'm online business. It's TuttleNutrition.com. That's where you can contact me through there. My wife and I both work full-time from home doing essentially the same thing. And a lot of people might look at our website and think we mainly deal with competitors. I would say 90% of my clients are not competitors. A lot of nutrition-related disease, digestion issues, IBD, IBS. We have a lot of nutritional allergies, things like that to deal with. We do a ton of situations where, you get a whole bridal party getting ready for a wedding, and they'll have to get in shape for their dresses or, for the wedding day. We do a lot of stuff like that. But it's all general nutrition, anything you need to do. I've done marathons before. I had powerlifters, cage fighters. Nutrition's nutrition. If you know nutrition, you can kind of work with most anybody with their particular thing.
Yeah, it kind of goes back to the essence of Hippocrates, let your food be your medicine and your medicine be your food, which unfortunately has not been the main thing utilized today in the healthcare arena, but it is changing. This big aspect of functional medicine is really gaining some ground. And it's not just, and that's another thing too. When I say functional medicine, most people think it's just throwing nutrition at somebody. It's really helping them adapt a better lifestyle, integrating some of the things that we talked about before. And that's kind of the paradigm that we use too. So, you sound like you're doing a great job, and continue what you're doing. And once again, we're available to help you out if you're interested as well.
Yeah,
awesome. Thank you very much.
Chris, thank you so much for coming on. We really, really appreciate it to have a high caliber guest like yourself. And we will be, linking and plugging, put the links to your business in your Instagram as we put this on YouTube and our other social media platforms. And thank you again.
Great. Yeah. Thank you very much, guys. I really appreciate it. Nice meeting everybody.
Likewise. All right, have a good night.
All right. You guys take care.
You too.
Bye.